On this, we're joined by Dr. Georges Benjamin here in Washington, D.C. He's the Executive Director at the American Public Health Association. Welcome to the program.
Thanks for having me.
Of course. So, President Joe Biden has just crossed his 100-day mark in the White House. How would you, generally speaking, rate his handling of the pandemic? What has he done right? What could he do better?
Well, he's done extraordinarily well. He's increased the amount of vaccine that's available. He's increased the number of places where you can get vaccinated. He's increased the number of vaccinators, people that actually put the shot in the arm. And quite frankly, the results are in. 100 million people fully vaccinated here in the United States in his first 100 days. He's more than done what he said he was going to do.
But, Doctor, to give credit where it's due, how much of this, the success of this vaccination effort under the Biden administration is actually the fruit of Operation Warp Speed started by the former president?
Yeah, look, the Trump administration absolutely gets credit for letting their scientists do the science, and they should absolutely get credit for that. But the Biden administration gets credit for actually implementing, and they've just done a marvelous job. But sure, Trump administration and their scientists, many of whom, by the way, are still working for the federal government, did a marvelous job of getting the science right.
Now, as you mentioned earlier, the vaccination rollout is now at such a speed. More people are getting it, but we're also at a point where we have in some places more jabs than actual arms receiving it. Is this a distribution issue, or is this more hesitancy on the part of the public?
There's a variety of issues. One, we have maldistribution. We have more vaccine in some places where people are willing to get vaccinated, in some places where we don't have enough vaccine, and they're working that out right now. We also still have some hesitancy, meaning people that are concerned and aren't quite sure they want to get vaccinated, but we think that will get better over time. And then finally, we still have some structural issues. We have some places where we just haven't gotten into those communities to get vaccinated. The last 20% of any public health program, trying to reach your goal is always really, really tough. And so the easy part's been done, even though they've had extraordinary leadership, and now they really got to work on the hard part, and that's getting to the end zone.
And how is that infrastructure now to get to those really hard to reach places? How do you see that being improved?
Well, they've done several things. They've now gone to programs and clinics that are actually in the community, our community health center network. They've begun to work with private practitioners so they can get to their patients. Even the retail clinics, the pharmacies that were got into this program are now reaching out into the community. We've even have our rideshare services, Uber and Lyft, who are now participating in getting people from home into their clinics to get their shots and then back home again. So it's been a really remarkable process.
Doctor, this week we heard President Biden announce that if people are vaccinated and outdoors, they don't need a mask. Do you fear a return to kind of the politics of masks in this country, where some people are wearing it, some people don't, and people just don't know what to do?
I think that we need to continue to articulate the science. And what the Center for Disease Control and Prevention said was that the risk for getting infected outside, if you're fully vaccinated, is extraordinarily low if you're not around a lot of people. It gets higher if you're around a lot of people. So they still recommend we wear a mask if you're in a large crowd. But that if you're going to be with a small group of people, particularly your family or your neighbors who have been fully vaccinated, then the risk is extraordinarily low, and you should be okay. And even if one does get infected, the likelihood of that being a large outbreak is also very small.